My guests are seated. I have Elvis Darko, who is the editor of the Finder newspaper. Elvis, good morning.
Good morning.
How are you doing?
I can't be good in the era of coronavirus.
It was a bit of a COVID-19 weekend, wasn't it?
It's not a bit of, it is a COVID-19 weekend. It has been coronavirus up to this morning.
It's crazy. It's crazy.
The fluidity of the issue is making everybody confused. Nobody knows that this is the only way to go. This is the best way to go. It's like across the globe, everybody's trying a different strategy to be able to contain. Therefore, for a country like Ghana, you ask yourself, even if the bigger countries are struggling to deal with it, how about us? So really from the day the announcement was made that we have the case, so now I think a lot of things have been running through the mind. And it's been a COVID weekend.
Yeah, I know. Well, my other guest is also seated. He's Kwame Jantuah. He's a lawyer and a former vice chair of PIAC. I'll let him add his other titles. Good morning, Kwame.
David, how are you?
I'm good. How are you?
Everything.
How was your weekend?
Okay.
Yeah.
Listening to the news.
Any perturbations or you?
Will I be right in saying, and probably this is out of context, that in as much as people have died, we are really hyping this thing? Will I be right in saying
Do you think so?
I don't know.
My position on this. I think it's better that we overdo it.
Yes.
And keep ourselves safe, largely as a country.
Yes.
Than taking it for granted.
Yes.
And it having a major wipeout situation.
I wouldn't expect us to take it for granted. But the other side of the coin is that it breeds fear and panic. I had a few calls from relatives in the States, and there's been a lot of panic buying.
Yeah.
Shops are empty.
Yeah, I mean we've been seeing videos of it. People fighting over toilet roll,
one of the things,
tissue.
One of the observations some of them made was that those who have the wherewithal are able to buy.
Yes.
Those who don't have are not able to buy.
Absolutely.
And it shows a huge distinction between the rich and the poor.
Yeah.
And so I hope we don't get that in this country.
Now, you know what somebody said, right?
Yes.
Karma is pretty good at dealing with, us for our negative attitudes. So, the rich employ the poor. You go and buy all the tissue and the hand sanitizers and keep them out of the hands of the poor. If they get infected, they're coming to your house.
Yeah.
They're coming to your workplace.
Yeah.
You're employing them.
Yeah.
So you're going to get it whether you like it or not.
That's the thing about this particular virus. As Jifa said, it has no color.
Yeah.
It doesn't care who you are.
Yeah.
But the ironical thing is that Africa seems to be getting back at Europe. And why do I say that? During the time of Ebola, what didn't they do to us? They canceled flights, they did all this kind of thing.
Yeah.
Right now, Africa is getting it from people coming from Europe.
Yeah.
And unfortunately, it looks as if around the world, health services are not ready for this pandemic.
Yeah.
But it also goes to show that we are a global village. When we talk about a global village, we are a global village. And technology has made us a global village. And so let's see how best we handle it.
Okay.
And let's make sure that the numbers can stay as low as possible.
Well, let's begin. Let me just read the first story to you, and then we'll have a conversation about that. The nation, I'm going to read from the Daily Graphic. The nation confronts COVID-19 head on. Excuse me. Public gatherings cancelled. Schools closed down. The president, Nana Addo Akufo-Addo, has banned all public gatherings for the next 4 weeks. In response to the confirmation of 4 more coronavirus disease, COVID-19 cases in the country. The public gatherings include conferences, workshops, funerals, festivals, political rallies, sporting events, as well as religious events such as services in churches and mosques. Okay. Now, the president announced this in a televised broadcast at exactly 10 p.m. last night. Right. The president said private burials, which is a heavy cultural usage in Ghana, were permitted, but with limited numbers, not exceeding 25 in attendance. Schools closed down. The president also directed that all universities, senior high schools, basic schools, private and public, were all closed from today until further notice. President Akufo-Addo has said he had tasked the Ministry of Education in collaboration with the Ministry of Communication to roll out distance learning programs. The exception, the president stated, was for candidates of the BECE and the West African Senior School Certificate Exam, WASSCE, candidates. They will be allowed to attend school to prepare for the examinations, but with prescribed social distancing protocols. All right, so he goes on to say here, further, President Akufo-Addo said businesses and other workplaces can continue to operate, but should observe prescribed social distancing between patrons and staff. Similarly, establishments such as supermarkets, malls, restaurants, nightclubs, hotels, and drinking spots were allowed to operate, but should observe enhanced hygiene procedures, providing, amongst others, hand sanitizers, running water, soap for washing of hands. All right, and then finally he says here, the president added that the Ministry of Transport he had directed should work with transport unions of private and public transport operators to ensure enhanced hygienic conditions in all vehicles and terminals by providing, among others, hand sanitizers, running water, and soap for washing of hands. The story goes on there. But I want to start with lawyer Jantuah on this one. Is this enough or is this overkill?
David, you're the same person who said just a few minutes ago that it's better to be safe than to be sorry.
I think so.
Yeah, so why can it be overkill?
Okay.
I don't see the overkill
but,
nature.
Okay, then if it's not overkill, is it enough? Should we add more to this?
Well, the thing is that it's not only the directives and what the government does that is more essential. It has to be in concert with civilians and the population to be also, they also have to do their bit in terms of safety, in terms of making sure that they understand what this virus can do and what they need to do to protect themselves.
Yeah.
The one thing I feel that hasn't been pushed hard enough is, so if you're in your house and you feel the symptoms, what do you do?
Well, they said there's a number to call.
Well, how many people know that number?
True. I don't know it offhand.
Exactly. And, you know, the other thing is that we seem to be concentrating more on the urban areas than the rural areas. So what's happening there? What's happening in the rural areas? Do we have our information vans out there, you know, trying to educate people and disseminating information and all that? Do we have that? Yeah, in the urban areas, and those with, you know, smartphones tend to get a lot of information on it. Yeah. So even if you haven't heard what is going on, you read it on your phone, or you hear it on the radio, you hear it on programs like this. What about those in the rural areas where there's quite a mass of people?
Yeah.
So I think that should also be looked at. Now, the president indicates that, you know, for the next 4 weeks, there's a ban on festivals, a ban on funerals, public gatherings. I ask the question, what is a private funeral?
What's a private funeral?
He put a number of not more than 25 people.
Yes.
So what's a private funeral?
That's a private funeral.
Now, in our kind of environment, even if it's family alone, it's more than 25 people.
Then it's not going to happen. It's as simple as that. I mean, the rules are very simple. If you can't keep it down to 25, you're not doing it.
Okay, fair enough. Who's monitoring?
That's a good question.
Who is monitoring? You know, when such directives are put out, there has to be a strong monitoring system in place to make sure that it doesn't happen.
Yeah.
festivals in the rural areas, if they haven't heard it and they still have their festivals, one might say because this seems to be an imported illness, because all the reports come from those who have traveled and come into the country.
Yeah.
So it might not reach the rural areas, but it can reach the rural areas because you've got citizens
who go home.
Yeah. When they come in, they go home, And so, in as much as we have put this in place, and I think, for me, the president seems to have taken the lead. I think he seems to have his hand on the pulse. And he's doing what we all expect him to do, to be able to make sure that this virus is contained and to be able to make sure that Ghanaians are aware of what happens. That, I think, he's doing well on that score. I just hope we don't get to the point of panic buying. I just hope we don't get there.
Well, there's a semblance of it already happening. When you have sanitizers that go for 10 cedis, going for 150 Ghana cedis.
Well, I was coming to that.
Okay.
I was coming to that.
Okay.
I don't understand us. I don't understand us, we as
the Ghanaian psyche.
Yes, I don't understand it.
Profiteering.
Something that, you would think would bring us together.
Yeah.
Keep the price and even be prepared to
maybe
give it up.
Slash prices and just distribute.
Exactly. We rather are hiking the prices.
Yeah.
And I got a few of the shops that have done that. Someone just sent me a WhatsApp.
Okay.
180 CDs.
Wow, that's even higher
CDs.
than I thought.
Yes.
Yeah, it's not 150
Some are
CDs.
80 CDs. I mean, why? I mean, and for me, this goes back to my assertion that in this country, money comes before anything else. It is wrong for us to be doing that kind of thing. And it's up to government to make sure this doesn't happen. Sanction people heavily.
Yeah.
Because we need the sanitizers. We need the face masks. We need anything that would help. We need the tissue paper. Anything that will help bring this thing down, we need to do it. Then the question I ask, what about marketplaces? We've banned festivals, we've banned funerals. That means my father's funeral is not going to come on. We banned...
Later.
Well, it's not going to come on for the next 4 weeks. So, we've banned gatherings in public places and all that. What about marketplaces where there's a much closer contact? And in fact, today when I came and I was doing makeup, when I walked in, I had to wash my hands downstairs. So I went into the makeup room, and the lady doing the makeup was 2 seconds from me. And that defeats the purpose.
Yeah.
Because close proximity is also dangerous. And so we need to look at some of these things. But then I ask the question, if we were to close the airport, what would the impact be?
Yeah.
Has anybody looked at that? Because, as I said earlier, this is an imported disease into the country. What will it take to close the airport? And I hope the manifest of all these 6 people who have come in has been looked at, and the people who were
they take the data at the airport. They're taking the data. So at least your seat number is taken, so we know who was sitting by you on the flight.
But it's not only, you see, don't forget, David, the cabin of the airport is a compressed space.
You mean the aircraft?
Yeah,
yes.
The aircraft itself, the cabin itself is compressed. And any sneeze, any
will
cough
spread further than the normal. Yeah.
Exactly. The air you breathe is confined in that area. In this place, okay, we can open a window, fresh air will come in, and it would, augment whatever air is in here. In an aircraft situation, you don't have that. So the air circulates. If you remember the days that people used to smoke on the flights, they would have a different compartment for them, but you still feel the smell within the aircraft. Yeah. So, I wonder if we've been able to identify those who were within, the space of the aircraft, especially when you have some aircrafts taking 430 people. Yeah. Quite a huge number of people. Yeah. And so, for me, we still have a lot of work to do to make sure that this thing doesn't spread. Although, when you read certain writings, they indicate that the reason why possibly Africa hasn't gotten an explosion of it is because in some countries, during the Ebola time, we had the service centers there, and those service centers are still operating. So we are moving faster than most of the European countries are. But then we don't know how many people are incubating, because that's the most dangerous bit, the incubation of it.
Okay, all right. We're going to take a short break real quick. We'll be right back. Please don't go anywhere. All right, welcome back from that break. And remember that the hashtag is Breakfast Daily. This is the news review segment. And my name is David Kwaku Sakyi. Let me just read a couple of messages that you've sent in by WhatsApp and keep sending them in as well. It says here, banning public gatherings and closing down schools is a good move in the right direction. But we expect that the PPEs, that's personal protective equipment, should be provided to the hospitals and general public with immediate effect, just as the directives given by the president. It is better to walk the talk than to do the talking. This is Abdul Mumin Wunam from Tamale. Farouk from Tema says, Ghana is at the crossroads. Let's stay united and fight this COVID-19 viral disease. President Kufuor's apt instructions in limiting public gatherings must be religiously observed. We urge our media to please limit the rush to break news and preach calmness and education about COVID-19 symptoms and its prevention. All right, so this is Farouk from Tema. Thank you for those messages. The number to WhatsApp us on is 055058582. And if you're outside Ghana, use the country code +233. All right, let me go to my other guest. Elvis, the government has also issued a travel ban, and we want to look at what sort of impact this is going to have. One, on is it enough? Okay, is it rigorous enough? Number one. Number two, what sort of impact will it have on the disease as we know it, the spread? Okay, and then number three, the economic, aspect of it as well. Let me just quickly read a few paragraphs from here,
Let's move on.
and for the benefit of our listeners. Okay, so government imposes travel ban on COVID-19 countries. 6 cases recorded. The government of Ghana has imposed a temporary ban on travelers from countries that have recorded 200 or more cases of coronavirus. However, the ban is not applicable to Ghanaian citizens or foreigners with valid Ghanaian resident permits. The travel ban was announced by the Minister for Information, Mr. Kojo Oppong Nkrumah, at the media briefing on the update of COVID-19 in Accra yesterday. The Information Minister also revealed that the government of Ghana is at this moment discouraging any form of travel to the country. All travel to Ghana is strongly discouraged. Non-Ghanaian citizens who within the last 14 days have traveled to countries with more than 200 confirmed COVID-19 cases are barred from Ghana. There is also a mandatory 14-day self-quarantine upon entry into Ghana, Mr. Oppong Nkrumah reiterated. All right, so looking at this as it's been described and government seeks to implement, like I said, first of all, is it enough? Particularly when the statement says all travel to Ghana are discouraged, strongly discouraged.
Well, before I come to the travel ban, first of all, let me say that the disease is not airborne. There is so much panic in the system, and people think that it's an airborne disease. It is not. It is a disease that you contact from droplets of an infected person who might have coughed. That is how you get it. So it's not an airborne disease. So don't say
as in it's not floating in the air for long hours.
Have it and I cough here, the possibility that some of the germs may enter you is high. The possibility that some of the germs will fall on this surface is also there.
Yeah.
So that's why the concentration is on about hand washing and hygiene.
Yeah.
Because if I cough and you are not here and the germs fall here, they can survive for some days.
Yes.
So if you come and you put your hand here, or the way I put my phone on my iPad, it may pick the germs.
Yeah.
It may enter my hand.
Yeah.
And then at the end of the day, If I don't clean my hand well, I don't follow the hygiene,
and you touch your
even
face,
though nobody coughed directly at me, I picked it from somewhere, and now I infested myself. That's why the focus is on keeping your hands clean, follow hygiene. Even your phone, apply sanitizer sometimes to clean it, because where you keep your phones and the number of times you touch your phone is high in a day. So it's not an airborne disease, it is a droplet that you may pick up from any surface if somebody dropped one there, or if somebody infected coughs at you directly. The possibility that some of the germs will enter you, virus will enter you, is what will infect you. That's number one. Number two, we should also understand that so far, if you look at the figures that are coming across the globe, it is suggesting that people who are aged, over 60 years and above, people with terminal illnesses, and people with low immune systems are the ones who are actually dying when they get it. People without these conditions who have the disease, majority of them have survived and have recovered and are walking around. So we need to pay attention to this crop of people in our society. The aged, those who have terminal diseases, conditions, and then low immune system. These three, we need to pay attention to these people if we really want to control this disease. So that one is also very important, because the number of people who have died, over 70-80% are people who are the aged. That is why Europe is struggling, because Europe has an aged population. So that is why the disease is having a lot of havoc in the advanced countries. So we should understand that this is the situation we have to look at.
But it was reported in one of the British papers yesterday that a young child who was born has it.
No, children have it, but they don't die. It's not about the contraction.
No, they get infected.
It's not about the infection, but the death rate.
Yeah.
Those who are young who have it, according to the figures that they have analyzed so far, children and people after the age of 40 and seems to be recovering on their own, even if they don't have treatment. But people who are like 60, 70, 80, older people,
then I'm in trouble.
They are the ones when they contract. It's difficult for them, because they say their immune system are normally low, and some of them may be living with terminal illnesses
or some pre-existing
conditions. So they die when it comes. So the numbers that have died, majority are those people. So some countries are paying serious attention to the aged as against the young people. So we should also, as a country, once we are taking steps, we should look at it. The ban the president has brought, they are very fantastic. We need these things, and somebody like me had always advocated that if I look at what happened in the West, when the disease started, they were like, oh, some new disease has popped up in China. So we made it a China disease from the beginning. We forgot that China has become the hub where we all purchase and do everything. So we forgot that our people were going there up and down. So by the time we realized that it is not a China disease, most of the Western countries already have it among themselves. And now to tackle it has become a problem. So we, as I said, once the case was declared, I was advocating that we shouldn't even wait, that we should have a certain number. That was the problem they had in Europe too. When they even recorded it, they were like, oh, let's wait, it's not an emergency yet. And now you realize that across the world, most countries, a lot of countries, Spain, Italy, so many countries have announced almost a partial lockdown or full lockdown to be able to see their way out before. Japan announced a lockdown immediately. I'm reading today that some of the schools, after 2 weeks, they found a way of addressing. Now some of the schools are reopening from today. Because Japan has finally found a way of dealing with it. So now they are reopening schools from today. Schools in Japan, 2 weeks after the massive ban, they look at how best children can go to school without massive infection. And now Japan is reopening schools from today. So for some of us, we thought that we shouldn't follow what led to the spread in the Western countries. We should ban early, find a way out, and then when we are sure of finding a way out, we can open all the mass places, because now we found a way out of dealing with the situation. They may not be cured, but we may find strategic way that are dealing with the disease. So I'm happy. But for the schools one that we are asking the final year students to go to school, I think that my suggestion is that Ghana and Nigeria should write to PIAC and say, look, we have an emergency at hand. Postpone the exams. When we know our way out, that is the way we are going, we'll let you know. Then you give a duration for the students to learn and refix the exams to write. I don't think that we are banning for others and say because these boys are in final year and we should allow them to go back to school because they are going to write exams. They have to be healthy to write exams anyway. So for me, if I had my way, Ghana and Nigeria are the top guys in PIAC. If we can put our heads together and say, look, PIAC, suspend exams for now. Let's wait. When we find a way out and we believe that now students can go to school, and then we can let you refix a new date for WAEC. After all, the people have to be healthy to go to school.
Yeah.
The self-isolation that we have announced, the question I asked, how are we going to monitor it? That is something I want government to publish something, the steps they think that government is going to take to monitor it. I just read from a UK newspaper that if you are in self-isolation and you don't obey, you are paying £1,000 fine for not obeying that stay home and you don't stay home.
Okay.
So they have actually imposed fines that if you disobey the rules, you will be fined, or even go to some jail or some punishment. So I think that we need the steps that we will have some confidence. If we say this is how isolation is being done, this is how it's going to be policed and monitored to ensure that people actually follow the isolation. For me, that aspect is what I want to look at. President said we should look at education through technology. The question we should ask, what kind of technology have we deployed in the education system up to now that we are going to rely on? So I think it's a very good thing he said, but I think that we should look at if there are private institutions that have some form of technology that they have deployed.
Yeah.
Because I know of Wolo. It's a private institution that is trying to deploy education through technology, and they even are on television. So I think that instead of government trying to fix all the problems, some of them they should look at partnerships with private sector.
Yeah.
Now we are told that it's only Noguchi and Kumasi Center for Disease Management or Control are the only centers. So it means that from Kumasi all the way up north, it's only one center, Kumasi. All the countries below Kumasi, all the way the regions to Volta, we are all relying on only Noguchi. Noguchi already said that they are even under pressure because the numbers that are coming are huge. So if the testing centers are slow, what it means is that you are going to get the results at a slower pace.
Yeah.
When you get the results at a slower pace, what it meant is that if you are not careful, the spreading is going to be high because your testing is becoming slower because more samples are being set there. In America, they have brought on private labs which have the capacity. The states have brought them on board. All 50 states, they have several testing centers that are being used to be able to tackle it. If the state can look at private laboratories in Ghana, if there are some that will have the capacity and can do it and they will need certain support, I think that the state must look at some of these strategies and bring those on board so that we can have more labs testing so that we can have the results faster. Because if you don't have the results quick, what it means, by the time the results has come, maybe the person has also given it to somebody that is a contact that should have been contacted earlier. But because the results are not confirmed, you are not tracing that person. The results delayed before you come and trace the person and the person is infected, probably the spreading rate might be higher. So I think that we should also look at the laboratory aspect, how best we can look at private laboratories to come in. For me, the ban for the airlines, I said our food and imports we are talking about mostly come from the port, is the ships, not the airlines. So if we can also take at least 2 weeks ban, 3 weeks ban on flights from affected countries for the time being, when we find our way out, we'll resume them.
I don't think
the
airline ban is to do with cargo.
No, that's what I'm saying. That's what I'm saying. So
cargo can still go
right
on.
now, if you can buy passenger planes from countries, because we have been told that all the distance are imported. It means that somebody traveled outside and is returning and brought it. So it means that if we can limit the entry of people from the affected countries, then the rate of infection may be slower. So we can also look at that. For me, if we have a ban, we are not banning them forever, but at least 2 weeks, 3 weeks. As I said, Japan, 2 weeks after the closure of schools, now schools have reopened today. Some schools have started reopening today. So these things are just to enable us try and sit down. Okay, what is working in Ghana? What is working in Nigeria? What is working in Spain? What is working in which of these things that are working in other countries can we also add to what we have for them to work for us better? Once we have come out to that kind of strategy, schools and everything can reopen. So for me, if we can have a ban on flights from affected countries, at least for a minimum of 2 weeks, for us to find our way out, I think that we can make it. But now that we said, if you want to come, you can still come. But then we'll quarantine you for 2 weeks before we let you in. And we are letting our Ghanaian citizens in because we can't stop them from coming to their countries. But we are talking about self-isolation, which we have not been told how we are going to monitor that self-isolation. That aspect is a bit something we have to look at. But I think generally, the steps we have taken now, I think that generally the president has shown leadership. He has shown that he understands and have a better idea of the situation around the globe, and he wants to protect his citizens from getting to the levels that we are seeing in other countries. And I think that the government needs to be commended for some of these things, because if you compare to some other African countries, like some are not really taking the kind of steps that countries like Ghana have taken. So we have to commend the government so far for this initiative. And not only the president, the people who are not sleeping 24/7, the committee, the ministerial committee, and the members who are not sleeping for 24/7 trying to come out with these strategies that are going to help us, I think they all deserve commendation.
Super. All right.
David,
yes.
The impact on the economy.
Yes.
What kind of impact are we looking at, especially on the airline business and all the affiliates that serve the airline business? It's going to take a hit. I'm not an economist, so I can't really tell you what that impact is going to be with regards to GDP and all that kind of stuff. But perhaps it will slow down the rise of the Citi.
Yeah.
The other question I ask, I think we also need to be able to let people know the duration of this virus on other things. So Elvis talked about solid
like surfaces.
And I hear that on a solid surface like this glass, it's 72 hours.
Okay.
The least is copper. Understand where copper is concerned. If the virus gets onto a copper surface or anything to do with copper, it's only 4 hours.
I see.
I think that is very important. But the other thing I've been, wondering is money.
Money?
Yes.
What about money?
In terms of, so if somebody has the virus and sneezes on money.
Ah, okay.
Currency.
But some countries are actually disinfecting
their currency. Some are actually printing new ones to replace the existing ones.
Well, that is neither here nor there, because if you bring new ones in and somebody has the infection,
what you're doing is that you're reducing the viral load.
Yes,
that's important.
Because the older ones have already been infected.
In any disease control,
them,
the viral load is critical.
Once you bring new one and destroy the old one,
so then
the infected ones, some of them
people's cards, that too has a surface.
Yeah,
that too can carry.
So then that one becomes more of personal responsibility, because you're not sharing your card with
and that is why the hygiene is important. But I want to say something. Yesterday,
education is key.
President Trump held a press conference. One of the things he said that I also am happy about was that they have spoken, they called all the supermarket chains in America as the president start and talk to them and say, look, you can't close down because we are in emergency. You work, but when you bring in goods and it's finished, we disinfect, you bring it on. So he assured the American public that the panic should stop, because whatever you need to buy, you will be available. We need a similar measure from government, because right now, sanitizer has gone from 5 cities to 150 Ghana. We need to give people a certain confidence that we are not going to have shortages. If we don't have that confidence being instilled in people, then the panic buying may happen in Ghana. So I want the state to be able to come up with a crafty message to the public that don't panic and go and be rushing and hoarding things. I saw somebody send me a picture this morning of his fridge, and the whole fridge is loaded with plantain. Plantain is full of the fridge. The whole fridge is plantain. So I believe that planting for food has brought a lot of food this year. We shouldn't panic and be running and going after to go and buy rice, buy plantain, and load the things into our room. I don't think that's the way. So I believe that we need that message to avoid the panic. It's important.
But Elvis, the other side of the story is that quite a lot of things are imported into this country, and are imported from most of the countries that have been affected by the COVID-19.
Yes.
Now, because of that, they are not able to go and bring in stuff. So there's definitely going to be a shortage somewhere.
Yeah, but I'm happy.
I think what should happen is that if there's going to be a shortage like that, let's see what the alternatives are.
Yes,
perhaps it's now time for Ghanaians to look more at our own food.
So if we don't import rice and we can eat plantain,
and our taste buds should change.
And plantain is in season.
Exactly.
Why do you have to rice for plantain? Why can't you fill the fridge with plantain or not like plantain?
We're even growing our own rice.
You understand? So let's have some of this. And see, China, according to a video I watched last week, they are back to production about 90%. Now they've contained the disease to a point that they are back to factories and started production.
But people are still scared of going
there. And that's about they are started production. So let's not think that there's going to be so much shortages in the system. The nonsense that's happening with the sanitizer issue, we need to address it. I'm happy that the president is going to meet the pharmaceutical companies this afternoon to ask them what they need to be able to produce the simple things that we need in this country. Whatever they need to be given to them immediately. So that simple things like sanitizer, which can jump from 50 to 150 Ghana, will be stopped. How many Ghanaians can go and buy sanitizer for 150 Ghana? Even the 2 cedi one.
No, but that's not the true value of it. I mean, it's ridiculous.
It's difficult for people to even buy the 2 cedi one. And the 2 cedi has jumped to 50 Ghana. How can people buy this? And we are saying that it is an essential aspect. And let me say this. People are claiming the alcohol. Yesterday, I listened to the head of Nuguchi said nobody should deceive anybody that alcohol can help you. That before alcohol can help, they treat it, they mix it with the ionized water, they prepare at a certain level. That's the only way. If you go and take common alcohol and you are washing your hands and say you are cleaning the virus, you are wasting your time.
No, absolutely.
Please, misinformation and disinformation, we must tackle it head on. Because a lot of them are going on the system.
Elvis, with even to support what you're saying, you know there's something called 100 proof vodka. 100 proof vodka is supposed to be a very high level of alcohol, right? You can set fire to it and all of that. But in truth, it's only 50%.
Okay.
The other side is 100 proof.
But I saw somebody took a local drink and did a video and put on social media that the sanitizer has gone up and that this drink can kill them, and was washing the hand and saying, you just go and get it and drink some. And this video was flying on social media. So please, let's tell people that stick to the professional advice.
It's dangerous.
Whatever you see on social media or any other place that is not coming from the health professionals, ignore. If not, people go and follow this nonsense advice. In Iran, some people claim they say akpeteshi. They want to drink akpeteshi. 27 people died from drinking akpeteshi because it's an adulterated akpeteshi. Wow. So please, let's tell people that forget about any other thing. Listen to the committee, listen to the health professionals. People who are health experts are talking.
I think it's very important.
Ignore any other thing else. If not, people will follow this and go.
But David,
the conversation.
The other thing that we also have to be very mindful of is that, yes, use hand sanitizers. The thing about hand sanitizers is that, sometimes it's sticky. And the fact that you've used a hand sanitizer doesn't mean that you shouldn't wash your hands.
True.
The moment you use hand sanitizer and you get to a point where there's a bucket and water, or there's,
wash your hands.
There's a Veronica bucket there, wash your hands. That's the only way. The other thing I'm not too sure about is, and I've tried it, liquid soap and actual soap. They're different. Maybe it's because of me.
No, they're not. It's not because of you. They're actually different.
Anytime I use liquid soap to bath and I wash myself down, I don't see the kind of dirt I see when I use actual soap to bath. Yes.
You're pampering yourself.
No, I'm not pampering myself.
No, but in this case, the carbolic soapes, like Guardian
exactly.
They are stronger than
the liquid soap.
Well, let us say that detergent soaps are what you should be using. Either medicated or detergent soaps will work. All right. So let's just advance the conversation a little further. I want to do the next bit of the story. Frontline health workers. This is from the Finder newspaper. The editor is right here. Frontline health care workers of COVID-19 to get incentives. The Ghana Health Service says government has started a process to provide incentives to frontline healthcare workers whose activities will take them close to suspected and confirmed cases of coronavirus. Dr. Bedusa Akodie, Director for Public Health at the GHS, said this would retain a competent and motivated health workforce in the fight against COVID-19 and ensure their well-being. He said this in an interview with the Ghana News Agency following the confirmation of the country's first 2 cases of the flu-like virus. The infected persons who arrived from the country, and he goes on and so forth. He says, so he says here, I jumped a little further down, he says here, so there will be quite a number of promotion and preventive activities, and all these require resources. The funding would help in this regard. This is talk about 100 million that US dollars that the government has made available. Yes, so incentives for frontline workers. Is this the way to go? Is this what we want to do?
Well, I think it's always good to motivate people who are putting their lives at risk. Because if they also decide that we're also scared that we would get this disease, irrespective of the fact that it's my line of work, they would not put their all in it to treat others. So I think to motivate them is a good thing. But in motivating them, I think the most important thing is to make sure that they are also safe.
Yeah.
What is it that you're doing to make sure that they are extremely safe? Now, if they do contract the disease, what kind of opportunities are in place for them to be treated quickly? And not, they go into the queue like every other person does. So I think it's a good thing, and there are other affiliates that also have to be looked at.
Okay. Any comments on this one?
Yeah, I think that they're going to risk their lives, and we know that for the medical field, one of the issues is that practitioners sometimes actually contract these diseases. If you look at China, for instance, they said about 70 medical doctors contracted the diseases and died out of the process of trying to save others.
Ebola is a similar thing that happened.
So I believe that there is something that has to be done for people who really are at the front line to save situations, to motivate them to do it. And that is good. China, for instance, it is an order. When the thing happened, they didn't deploy even civilian people. They deployed military health workers. Were the first frontline people, because it is by order you need to do it. And they know what they have done. So I think that as a nation, if we can have some form of life insurance policy, something that the person will be entitled in case the eventuality happens, that is quite good. I think it's important, because recently I think the president announced last year that any policeman who died in line of duty is entitled to a certain huge amount. And that is because they were doing a duty and they died. So if the health worker too is going to do something that endangers his or her life, if we can have a similar package for them, that in the event that the eventuality happens, you are entitled to it, I think it will be fair. And I think that we need to let people know. But if we can let the details come out, because for the police one, it will clearly announce how much you'll be entitled to if it happens to you. So can we also have the details? If you are infected but you do not die, what do you get? If you are infected and you die, what do you get? So that they will be clear in their mind as to what they think is available for them. You don't tell them that there will be incentives when they don't know what the incentives are about. You can do that at the end of the day. You go and give them something that will be so rather demoralizing. So I think that the details will tell.
But David, again, I think it's a huge opportunity for employment. All these nurses who are not working now, it is time for us to open some of these centers along our porous borders and get these nurses in there to help in monitoring some of these things. So we should look at that side too.
All right. Okay. So a few more messages from our viewers. Roy says, Mr. Elvis Darko, thank you for the, I don't know if that's what he meant to say, but he says thank you for the exaggeration. I'm really enjoying the show this morning. I think it's probably describing your fervent. Okay, so good morning. It is true this disease may and will pose an economic danger, but the government must help protect the citizens by supplying various health centers with all the necessary material that will help us fight this pandemic before it gets totally out of control. It is creating too much panic, which is not good for us. Thank you. All right. Finally, one says here, this is Dixon from Kaswa. He says, banning social gatherings and closing schools is a good move from the president. But what about the marketplaces? Look at the nature of our markets. It should be one place of concern to citizens. I want to say a big thank you to my guest this morning. Thank you to you, Kwame Jantuah. Kwame Jantuah is a lawyer and the former vice chair of PIAC, and then also to Elvis Darko, who is the editor of the Frontline newspaper. Thank you very much, gentlemen. Thank you very much, viewers, for watching this segment of the show.
Hi, I hope you enjoyed the show. Do not forget to subscribe, like, comment, and share with your friends. This is Breakfast Daily on Citi TV.
Join the Breakfast Daily team Monday through Fridays from 7:30 a.m. to 10. Join us for breakfast daily, only on Citi TV.